as it is commonly called, is a surgical procedure to reshape the nose by altering the cartilages and nasal bones. Rhinoplasty can also address the functional problems in the nose like nasal obstruction or breathing. Those patients who have completed their facial growth, those who have good physical health, those who are non-smokers, those patients who are clear in their goals and who have realistic expectations of the results. The ideal age for a rhinoplasty would be those who have completed their facial growth and also the facial bony growth. So this would be ideally in the age after 17 to 18 years of age. Recovery time of rhinoplasty will depend on what kind of procedures you have undergone. Patients who have undergone osteotomies and extensive open septorhinoplasties can expect recovery time of around 2 to 3 weeks. Do's and don'ts post rhinoplasty. Always take the medication prescribed by your surgeon. Avoid aggressive blowing of the nose post surgery. Sleep with the head end elevated. Avoid any undue pressure over the operated nose. Avoid wearing any heavy spectacles or sunglasses. Use the nasal decongestants and nasal saline sprays. If you have undergone an osteotomy, I would recommend eating soft, cold, bland diet for at least 1 week. The cost of rhinoplasty will vary from patient to patient. It depends on how many components of rhinoplasty surgery we are adding to the particular patient. For example, if we are adding an osteotomy or we are adding a septoplasty or it is only a tipplasty. So the cost of rhinoplasty will depend on all these components. Patients undergoing open rhinoplasty can expect a small scar in the nasal columella. You can also expect some minimal amount of bleeding post surgery. You will also have swelling of the face and nose region for about a week. Patients who have undergone osteotomy can also expect black eyes for a period of 2 weeks. Patients can expect a recovery time post rhinoplasty anywhere between 2 to 3 weeks. As I mentioned earlier, patients can have swelling of the nose, and this takes considerable time to settle down, and it may take even 6 to 12 months in some patients to achieve the end results of rhinoplasty. Pros of surgical rhinoplasty. One, it gives an increased self-confidence to the patient. We can correct the underlying nasal or cartilaginous deformities. Two, I would say it is also a functional benefit to the patient. We can address problems like difficulty in nasal breathing or nasal obstruction when we do a septoplasty. The third pro, I would say, is we can address multiple areas of concern in the face. We can address your chin or malar region or cheek region at the same time as a rhinoplasty. I would say surgical rhinoplasty gives permanent lifelong results. Cons of surgical rhinoplasty. I wouldn't call it cons, but more like complications. Any surgical procedure has complications. So these are some of the complications of rhinoplasty which you need to know. One is post-surgery you'll always have some kind of discomfort or pain which will be managed with appropriate painkillers.